Firebox of
If you
Samoa.
need more, orders are still available.
Can't hear you over the crinkling.
Good evening and welcome to the regular meeting of the McHenry County Board of Health for February 10, 2025. I will call the meeting to order at 6:40 p.m. I'll ask the clerk to conduct a roll call, please.
Mr. Markison? Maybe not start with him.
Perfect timing.
Dr. Amsler? Ms. Carmen?
Here.
Ms. Altoff?
Here.
Ms. Gaffney?
Yes.
Ms. Morowski?
Yes.
Dr. McGuire? Dr. Katz? Here. Ms. Ortiz? Dr. Zurich?
Here.
Ms. Clark?
Here.
And Mr. Clark.
Here. Item 2 on the agenda is for public comment. Seeing no one here from the public, we will move on to item 3, minutes approval for the January 13th, 2025 meeting. Ms. Carmen?
Yeah, I make a motion to approve the January 13th, 2025 regular meeting minutes.
I'll second it.
The motion has been made by Ms. Carmen, second by Ms. Clark. Any questions, comments, corrections? Hearing seeing none. All those in favor of approving the minutes, say aye.
Aye.
Those opposed, say nay. Ayes have it, motion passed. Item 4, department and division updates. Ms. Adamson.
For those who have been following the Crystal Lake renovation project, we went to their planning and zoning in January. And we were not fully in compliance with how the ordinance is written. However, the consultant, so Kluber, worked closely with the staff at Crystal Lake and here, and in consultation, so they were able to come into compliance. So we didn't actually have to go back to planning and zoning. We went directly to the city council meeting and had met the test for the ordinance. So they did approve the project to move forward, so that is good.
What were we not in compliance with?
Well,
Brick.
oh, so a certain, yeah, they have a percentage of, sorry, the facade had to meet a certain percentage of brick or I think natural stone.
Oh.
So they made some modifications to the windows, they made them a little smaller, came into compliance, and everyone seemed to be pleased with the project. But there was a moment there where we were a little,
Except the people who lost windows.
what?
Except the people who lost windows.
No, they didn't lose the windows, they're just a little smaller to put more brick. It looks very nice. And
It was a cost-saving measure
Nice.
on the part of our architects, which is exactly what they should be doing, right? Is looking for us to use our money wisely. Unfortunately, they were unaware of the ordinances in Crystal Lake that required a certain amount of facade-type coverage, masonry coverage. And so they worked it out and all went well.
and here we are.
Cool.
So the good news is that we stay on timeline, so we didn't have to get delayed by having to go back to planning and zoning. I can't remember if this has been shared, but we have been working on an on-base electronic invoicing process. On-base is a document storage. It's to facilitate processing, storage of invoices, records, ordering process, to do it through an electronic means, and people will sign off. So staff just met with IT again today to kind of finalize the items that we had requested. So next week, or I think in the next couple of weeks, staff will test the process in fiscal, and then we will roll it out across the department. I did want to bring your attention to the staffing report in the packet. So, because if you just look at it and you look at some of the dates, it looks like, many of these positions have been open for a long while. The accounting assistant at the top, currently evaluating if we're going to keep that as an accounting assistant. The manager of fiscal operations recruiting is underway, so we've posted that. We've had some applicants. The health educator, that's a new one. I'll come back to the environmental health practitioners here in a moment. One of those, the one that says January of 2025, that is open as a result of an internal promotion. The maternal child health coordinator, so there have been several candidates interviewed. One has had a second interview, so I'm waiting to hear if an offer is going to be made to that person. The health educator, which is the 0.6, we are looking, and one of the public health nurses, so we've got a 1.6 between two of these positions. We need to look at getting drivers for the mobile clinic, some dedicated drivers. So in talking to county HR, okay, that's great. But you might be busy on some of the days that we actually need you. So there are a couple of examples in the county of PRN work. So we are looking at how we can retitle this position slash reclass, I guess is a better term, to use it as, give us the ability to hire probably 2 people on a very, very part-time basis. So
Do
as
they have to have
needed.
special licenses? I'm sorry.
Yes, they do have to have a Class C,
Okay.
but that they don't have to have a CDL. So they do have to take a behind the wheel, they have to take both a written test and a behind the wheel test to get a Class C.
You might want to reach out to Northwestern and see if they wouldn't post something for you, because they got rid of their service that picked up patients.
Oh,
And they
okay.
had a ton of retired individuals who were drivers.
Yeah, and we've had discussions about reaching out to the school districts, when their drivers are not. Right now, we have DOT that can help us out. We do have a staff person in our WIC program who has taken the written test but has to do some shadowing, I think, with DOT to drive it before they take the written test. So we want as many options as we can have. Because I think if we rely on just one person, and something happens that day and we have a clinic scheduled with the mobile clinic, that's going to be tough. Then when you come down to like the second nurse position on the list, that has been filled. And so it means it got filled between, January and today. And then the director of nursing has been filled and an offer has been made on the administrative specialist. So this should look different next month. Now, with regard to the environmental health practitioner positions, Patty and I have been working together with HR to create a new health inspector position, which would be lower than our incoming environmental health practitioner. So what that would mean is they can have an associate's degree with 9 hours of general science, I believe, okay? They have to be, though, under supervision of a licensed environmental health practitioner. But this would give us some flexibility on applicants that come in, because if you, I reviewed the most recent 5 applicants. 2 were interviewed, but I believe they did not meet the qualifications. And then another was not interviewed because they did not meet the qualifications. So this would allow us to hopefully tap into some talent just right out of an associate's degree, some college under their belt, bring them in, and then we can work with the systems that are in place with the county to do some continuing education potentially, or our SIPA grant, if that person is interested in moving up. I believe we also have one person internally already who meets this, who is interested in moving into this once we get a resolution, and Patty's working on the CPQ so we can get that back to HR. And then if you remember how we had that STEP program with the 3, so you're a 1, then as soon as you get licensed, you can become a 2, and then license plus 3 years experience makes you eligible to become a 3. So this would be the same thing. You come in with an associate's with 9 hours. As soon as you get to your bachelor's degree and meet the qualifications that are laid out in the statute, then you would matriculate automatically. So give us a little more flexibility without asking for more staff. Does that make sense?
Yes.
Patty, is there anything you want to add there? Okay. Any questions?
I just have one
Yes.
question, because I thought, one time we did hire someone who had a bachelor's degree but didn't have all the sciences, and you were able to like, still hire them because they were gonna take those math classes?
Right, it was kind of conditional that they had to meet those classes within a certain number of months. So they were really close. This is someone who's not going to be close to, how many credits is it, Patty? Do you know?
Well, they have to have.
For
a
environmental
bachelor's-
health?
They have to have a bachelor's degree in 30 hours of
Yeah.
science
Right,
and then
but-
specific sciences also.
Yeah, but for the people who were like, who applied, did they not even were close to that, the ones that weren't interviewed?
I can't answer that, Patty, can you?
No,
answer that?
that's not usually how it is.
Oh, okay.
Usually they're missing quite a few of
Okay.
them.
Okay.
That's
all right.
really the most common thing that we see with the
Yeah.
applicants is that really they do not meet the criteria for, statutory requirements for an environmental health practitioner.
Sounds like we need to talk to universities about that.
The two candidates that were interviewed but didn't meet qualifications, should we get approval for this inspector's position? Can we reach out back to them?
Absolutely. So we've had several that were interested, in that, if that type of position does open. Absolutely. We've got a short list of those.
All right, good.
So-
Patty, you said it's the state, it's by statute, they determine what science classes are required.
Right. It's the Environmental Health Practitioner Act. So in order to become licensed, you have to meet certain criteria. And then in order to work in the field and not be licensed, you have to always be under the supervision of a licensed environmental health practitioner. We're really fortunate to have quite a few licensed environmental health practitioners. We've had several get licensed since that tiered program has been put in place. So that's worked really well. We're just trying to create, one more
Yeah.
step in the career pathway.
Love the pipeline.
Yeah.
All right, thank you.
Okay, fiscal, so there's kind of a new look and feel. Again, I guess courtesy of me, since we don't have a fiscal manager right now. Trying to make it very straightforward, hopefully, about the reports we can pull from D365. So if anybody has any questions, it's the same information, it's just formatted a little differently. And it's very quick for us to generate this report out of D365 and verify the information. So I would like to move forward with this if the board is amenable and has any, if you have any questions. So the disbursement reports, just real straightforward. But the income and expense looks a little different, where you saw the income and expenses last month all together in one landscape view. Now it's a vertical view with the revenue on top, categorized by each of the divisions.
I like it.
Any questions? Oh, go ahead.
Oh, and then we don't have a nursing representative here, so I can just move on to that one if there's no further questions. Okay, so because of the project in Crystal Lake, we, end of last week was the end of our services in Crystal Lake on the clinic side. Animal control will remain. So IBCCP is our Illinois Breast and Cervical Cancer Program, and Wise Woman. Those have been moved to the Mental Health Board. You all approved a lease last month. And so just a big shout out and thank you to both facilities and IT and the staff from nursing who, that's not their program, but they helped move and get organized. So that moving took place last Friday. And then today, there was a lot of IT setup, all the charts that they had to unpack and all of that. So that's where they will be from now until the project is done and they're ready to move back in. Quick note on respiratory. You've probably seen it in the news, but influenza is showing high transmission. Both ED and inpatient data show higher levels of transmission as well. Hospitalizations are up from last year, almost 2 times higher than they were last year. And then, however, this season is similar in severity to our 22-23 season. So there may have been a little milder year for influenza last year. And then COVID and RSV are starting to come down. And that is all I have.
Any questions or comments from the board?
Do you have an idea, I apologize, do you have an idea of when the project will be complete and people move back in?
I think we have it through, like, our lease goes through November, I think. So assuming things stay on track and nothing gets, I think by the end of this year, I think is what we're targeting.
Thank you.
Thank you.
Yep.
Director Noel?
Sure, so last week we implemented the new SmartGov system in environmental health. So that's part of that joint project with the Department of Planning and Development. So this will be for our septic and well permits and our construction impact reviews. So definitely some adjustments being made, but this will be where our permit applications are submitted and reviewed and received online. So overall, it's going to be a good thing. We're just going through a few growing pains as we figure out the new system and help our, our customers get to that point too. And then also, sorry. Oh, that was you.
Oh, I'm sorry.
Sorry about that.
Just clearing my throat.
Okay. And I think we talked about this last year, but we've been working on trying to streamline our activity reporting system because unfortunately, we collect so much information in it that actually the system itself was onerous, right? And it was hard to get the data out. So we've been working on streamlining that, and I think we've come to a good spot. We're still working with IT about potential apps that we might be able to use to do it in real time as staff are out in the field, but I think we've made some adjustments and it's going to really help us be doing that in generally real time moving forward. And then I just wanted to mention I included our recycling event summary from last year in the packet, just for your information.
Questions from the board? Do you want to ask that question?
Yeah, I will ask it, but I don't think there's an answer. I haven't seen anything up on Arnold Engineering in the 300 West.
Yes, so they have moved from the site. So the site is still owned by 300 West. Arnold Engineering has relocated to another location outside of Marengo. So the process of gathering information in relationship to the groundwater contamination, et cetera, that continues to move forward. I do receive, periodic updates on that, so it's working through that process. And so really no significant, change, although the IEPA continues and the Attorney General's office continues to receive reports and push it forward.
Are they complying with providing bottled water and stuff like that?
To my knowledge, yes. And then a lot of the impacted residential properties did connect to community water, which was a very positive.
And they paid for it, I'm assuming.
I don't know the ins and outs, but I would make that assumption.
All right, thank you.
Any other questions? Thank you.
Thank you. There's just one thing I was going to mention. You don't see it too much on this month's data, but we are seeing a little uptick in what we call rescue animals. That's animals that come from evictions, animals that come from maybe someone either goes into a medical facility or a mental health facility. Just this week, we got 9 animals from an eviction where some of the people living in the homes or multiple people living in the home were going to different facilities. So I suspect we're going to see a little bit more of that since evictions are starting again and people are struggling. So I'll let you know if we continue to see an uptick in that. Other than that, we had our new officer start, came from Lake County, and then we have a new office person starting, and then we do have our other officer leaving at the end of this week, and we've already started some interviews for that third position. Besides that, getting ready for the renovation, just making sure we have all our ducks in a row for IT. If we need to move some of our offices into the conference room or when the other side's done over there a little bit, we're just still working out some of those logistics. And continuing to transfer when we can. Especially puppies, we have 5 of them right now that just came in this week, so.
I thought those are cute.
We have multiple puppies. I don't know if you saw these ones.
Oh, I don't really need to see them.
I don't look.
And actually, we have 4 really cute kittens right now, getting ready to go for it.
Any questions from the board?
Perfect Heck is taking in like 37 from eviction.
I wanted to comment. I had the opportunity this last week to tour animal control facilities. I was given a very good detailed explanation of the upcoming construction project, and they walked me all through the building and showed me where the improvements are going to take place, and it was exciting to hear. It's substantial, and it's going to be an improvement, so good on
We're
that.
excited.
I've got one. Here's a question I bet you thought you'd never, ever hear from me.
Lunch.
Dogs and cats. Reviewing the statistics from last month. Registrations are down for the start of the year.
Well, financially, registrations are okay right now, but, I'm sorry, did you finish your question for me?
Is there an explanation? Is there?
I think we're just still struggling with the VEX offices getting them to us. We are right now processing October and November's registrations. Not so much the money that comes in, although we do have some outstanding invoices that need to be paid, but mostly just data entry into the system. We have the part-time contractual person that we kept her on. You know, we really didn't put into the budget enough to keep her on the whole year at 19 hours, but we're still working with Chameleon. They need to get us a little bit more information about their contract and how much it would cost for them to do some of that data entry for us. So I think we're just still, if we get that new office person in, maybe we can catch up a little bit more. We're not so far behind as we were. Not as many big stacks. We're getting a little smaller.
Well, one of the statistics was outbound emails that were
Yes.
sent. And those are?
We spend a lot of time doing outbound emails for either people who want to relinquish an animal, somebody who wants to pay their registration through our website. Because first they have to send everything into us. We have to process that, see if they meet if they have everything they need. Then we have to send them something and tell them how much it's going to be. And then they have to actually go and pay it. So it's more than just I'm paying my registration online. It's a little bit more than that. So.
Okay, good. Thank you.
And it just, I don't know where you're at on this, but we've kind of gone, for us, because it's mostly me answering the phone calls, to digitally responding to people. So is there a way that, like, I know you have the prompt system.
Yeah.
But is there somehow that they can get directed to those online services digitally from?
We can certainly look into that, because we do spend a lot of time directing people to the online portals to take care of things they need to take care of.
Right. Or will it, or I know in today's technology, there has to be a way to, if it's on a mobile phone, you can send them a text that will have the link to
Actually, you know
that.
what we have now? We have QR codes. So if an officer goes out and someone hasn't paid for their registration yet, they say, here's a QR code, and they can go right on their phone and pay it.
Yeah. So right now, when people call us, it says text us, and then just for me, because I'm not that digitally forward, I just copy and paste what I have as a preformed answer to TNR.
Yeah.
And then they just deal with it from there. I don't ever talk to anybody anymore. Not that, I mean, I do talk to people. I do talk to people. But I answered, 10 calls from 2 days ago, and I didn't have to talk to anybody. So if there's a way that you can.
I know that Heather is working on more QR codes for people to have direct connection to those payment systems.
Thank you.
Thank you. Director Heck.
I just have 2 quick updates. So I think I mentioned a couple of meetings back that we are going to be doing our new community health assessment this year. So we should have a vendor picked by the end of the week. And then we are completing that with our hospital partners and some new community partners. So we're excited about that. And then I know Melissa mentioned the Crystal Lake services, like IBCCP went to the mental health board, but WIC is no longer in Crystal Lake. So just in case you guys needed to know that. They're going to be working out of Woodstock completely until we can get the mobile clinic up and running. And then we do have an MOU with the mental health board to park it in their parking lot for a little while to kind of meet the needs of the people that live out there that aren't going to be able to go to the Crystal Lake office anymore. So as long as we get our approvals by the state, we should be able to hopefully, don't quote me on this, but be up in the mobile clinic in March. So, yeah. But for now, all our WIC clients will be in Woodstock.
How often will the mobile clinic be there?
So we're thinking by April, we're hoping to be at the mental health board for like 2 days a week.
Okay,
Yeah,
every week.
but eventually we'd like to get to other areas of the county too, but it's just kind of gonna be a slow process to get everyone used to clients coming to the mobile clinic and get the WIC staff used to it and get over these hurdles that are gonna be different, you know, moms with strollers getting into there and things like that we're gonna have to work out, so. And each site may be different, so, but I know one of our locations we're trying to get to is Harvard too, so getting up there.
I think it's great. I mean, we have a big county and there's people in need who, I mean, even driving for these meetings, it's only 20 minutes, but it's,
They're in cars.
if you don't have a car,
Yeah.
right? Or if you have, it's very difficult to get away from your other responsibilities. I mean, you just can't access it then.
Right.
So I think this is a really nice stopgap. I'd imagine a time, you know, in the future where we have more satellite offices that are brick and mortar that can be a, you know, a full-time presence, but I think this is awesome. Thank you.
During this time period, is there a way we can coordinate with PACE for people that cannot commute to Woodstock?
I like that.
That they could contact PACE and they would be informed that I'll be picking somebody up in Crystal Lake and taking them to our facilities here in Woodstock?
Yeah, you're way ahead of us. Well, because we actually, at our last staff meeting, we brought in DOT to talk about the pay system, and then another, this partnership they have with Uber, which is a new thing where the county, you have to meet certain requirements, but they will pay like $16 up to each Uber trip you take. So Scott did come in and talk to our staff about the busing system and how we can promote that to our clients to get them to our location, and then the new Uber partnership that they have going on too. So we are thinking about those things also.
Okay, good. Any other questions from the board? Okay, thank you. And let's move on to item number 5 on the agenda, consent agenda. Any board member want an item removed from the consent agenda? Seeing none, we will,
I'll make a motion to approve the consent agenda as presented.
Second?
the motion has been made by Ms. Althoff, second by Ms. Gaffney. Any discussion? No discussion, it's a monetary item, so the clerk will take a roll call, please.
Ms. Althoff?
Yes.
Ms. Gaffney?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Dr. Katz?
Yes.
Ms. Morowski?
Yes.
Dr. Zurich?
Yes.
Ms. Clark?
Yes.
And Mr. Clark?
Yes. All in favor, motion passed. Thank you. Next item is item 6, contracts and agreements.
So this is, last month we brought a bunch of IBCCP contracts. This one just came in afterwards. So same thing, it's a provider agreement to provide services under the Illinois Breast and Cervical Cancer Program. Contract is the same as all the others that we've brought forward.
Make a motion to approve the IBCCP Modern Family Health Medicine Agreement and Contract.
I'll second it.
Motion has been made by Ms. Gaffney, second by Ms. Clark. Any discussion from the board? Any questions?
I just have one real quick. Is that pass-through money from the feds or is that a state grant?
It is, I'd have to double check if it's fully feds, but there's definitely pass-through federal dollars related to IBCCP. Yep. Actually, I think it is federal and state
Yeah, I think.
together. Yep. And so there was a meeting today actually from the state about IBCCP. Again, a lot of unknowns with regard to what happens with our budgets. So to be continued as soon as we have more information.
So, and I recognize government is government, but are there clauses, I don't know, are there clauses in that contract about termination?
Yep, it's a 30-day.
It's a 30-day?
Yep.
Okay.
And I'm a little confused. Is this a monetary issue or not?
Well, it's contractual in the sense that,
Yeah.
they provide services and we reimburse them for those services.
Okay, to be on the safe side, we'll do a
Yes.
roll call vote. Please.
Ms. Gaffney?
Yes.
Ms. Clark?
Yes.
Dr. Zurich?
Yes.
Dr. Katz?
Yes.
Ms. Morowski?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Ms. Altough?
Yes.
And Mr. Clark?
Yes. All in favor, and the motion passes. Next item is item number 7, new and unfinished business. Is, anything? Nothing on the category? We'll move on to item number 8, board issues. Any board members have any issues?
I forgot to ask Patty, does the Department of Health do anything about air quality? I know we were talking about like water quality, I know it's not measured as the same, but is there anything that goes on for air quality?
So we offer radon test kits, so we do some of the indoor air. For outdoor air, really, it's enforcement of the, burning prohibitions and the open burning restrictions. That's our primary involvement. If there were something larger, we'd get the Environmental Protection Agency involved.
Oh, okay, all right. I was just curious, like with the new, Huntley, Amazon, like if there's, more diesel, in the air or.
That's really an Environmental Protection Agency.
Oh, okay.
Yeah.
Okay, all right, thanks.
The board issue I wanted to address is to give advance notice or preparation notice that potentially, if we've seen the news, there's a potential that we may have to be called in to address issues in the not too distant future that may require special board meetings or even or special committee meetings or emergency type meetings. That'll all be initiated by staff when they address an issue. If it develops, they will contact us, and I'm just throwing it out there so people start thinking about it and ask for your consideration and to try to accommodate short-term notices. That's all I got.
Question, can you give us our new nursing divisional director, any insight into, we had the email and we have notice?
Oh, so she'll be here next month
Oh, okay,
because she doesn't formally start till the 24th.
I see,
Yes.
okay. I was like,
So I didn't
she
have
missed her
come
first
to this
meeting.
No, she did not miss her first meeting.
Okay.
She did ask if she should be here, and I said, she's welcome to come, but it wasn't necessary because technically next month will be the first.
Okay. And she's currently one of our employees, right?
Correct.
Okay. Other than can you just give us a snippet of what, how many have we interviewed and what was the process?
I think we got 11 applicants. We interviewed 5. We narrowed it down to 3. So we did second interviews with 3 of the candidates. And so the first interview was 3 people interviewing each candidate. Then we broadened the scope, and I think we had about 7 people in those interviews from nursing.
And have you, other than the short little synopsis in the email about, having worked with us previously, is there some sort of, again, a synopsis on the person and what you're excited about with her?
She's very passionate about public health. She has a strong foundation in public health. And I think her experiences bring, something, she has a breadth of experience that she can bring to the table. She wants to be very collaborative, involve the staff. She intends to sit down with them, individually and as a group and get their feedback and try to understand what their priorities are. She and I will work on some priorities that we establish, but I think she really wants to get to know the staff and understand how she can support them and what they see as the priorities.
Great. Well, congratulations. Good.
Build on yours. And from your perspective, does this assist you in changing the culture and the morale overall, and that vision? Do you
Well, I think
this a-
that is, yes, absolutely the hope that this person has the chops, to step in and rebuild that team.
Duly noted, thank you.
Any further issues? Okay. Next item is information and communications, the recycling event summary. That was just for us to read.
It is,
Correct.
yes, it's just for your information.
You don't want to read it to us?
There's a lot on there.
Hey, my comment is, good job.
Yeah.
Definitely.
I appreciate it. Kelly works really hard at it.
Item 10 is executive session. We do need to go to executive session to review minutes from last month. So I'll entertain a motion to go into executive session.
So moved.
Second.
Motion's been made
Thank
by Ms. Altoff, seconded by Mr. Markison to enter executive session. All those in favor say aye. Those opposed say nay. Ayes have it. Motion passed. We are in executive session.